There are so many different ways that a donor can connect to the healthcare delivery side to accomplish a goal that is in sync with their personal goals. For most people, being in the hospital or in a medical center can be a scary proposition, especially little kids. And so to have a place to go like Cully's Cabin where they can hang out and de-stress and get comfortable with the environment, I think it specifies and stresses the importance of that type of philanthropy, because it really does help the delivery of healthcare in a way that is not necessarily clinical, but it is very profound on the impact of the outcome of that child. Because we all know that stress can impede recovery. There are a lot of things that philanthropy supports that I think really helps add to the whole experience of the patient.
When donors give money that can be earmarked specifically for something we can't get quickly, that sometimes is life-saving. Right now there's an incredible opportunity to bring simulation to this town in a way that it hasn't been there before, in a way that draws in each of the colleges so we can retain the best students that are in this area and be able to hire them in order to carry out residents and other trainees that are in our healthcare system and push them to a new level. Those donors have made it possible to actually put those training environments inside this hospital. In addition, they've made it so in the emergency room we can video each of our trauma resuscitations. By videoing those trauma resuscitations, we can actually look back at those videos that following day and actually look at ways we can be better. And then we can discuss that as teams. And that's something that not a lot of facilities have the luxury to do. And we'll be able to do that 24/7 starting July.
Why I wanted to make this gift to the medical center. It's a very interesting question. Joe and I have been involved in giving in a lot of things to the hospital through the years. Many different things. And I remember when they were working on the heart hospital, we were involved with that, and probably myself or Joe made the comment that if they ever did anything from Parkinson's, we'd be really interested. And so Joe and I decided that we would start an endowment for Parkinson's. Everybody will say I was the instigator and Joe was the facilitator. So anyway, I instigated and Joe facilitated this endowment. In January 12th of 2014, Joe passed away. So I became the facilitator also. The reason Joe and I would give back to the community or anything, again, is that we always felt if we were blessed, we should also, in turn, give to others. And if people are in need, you want to help them. And so that's probably the good reason.
Whether it's the investment in the specialists, whether it's the investment in the facility, the equipment, it all adds up to a very different experience for the patient and the families. And we're excited. And I think that the community should be excited about the fact that this has happened in their own community. I think a lot of people, whether the gifts are large or small or whatever they are, they're really aimed at improving that overall human condition, which is really our mission as an organization.